My presentation will give an overview into the genetic disorder of Down syndrome. So my older sister Madison was diagnosed with Downs at a young age, and since then I have been able to see firsthand her developmental, speech, and intellectual delays she has faced. As a toddler, she was diagnosed with leukemia, which is a cancer of blood-forming tissues, and Down syndrome was first linked to leukemia in a case in the 1930s. Patients who have Down syndrome and leukemia have unique clinical features and respond differently to current cancer treatments than individuals who do not have Down syndrome. So Down syndrome was first described by an English physician, Dr. John Langdon Down, in 1866. Then, almost 100 years later, the association with the 21st chromosome arose and was discovered by Dr. Jeremy Lewin. So you can just see both their images off to the side there. So the presence of all or part of an additional third copy of chromosome 21 occurs from a basic mutation. These symptoms range from mild to moderate intellectual disabilities, slow growth, and distinct facial features. The number of symptoms each individual faces ranges, and each individual not have all these symptoms listed. So common facial feature changes that an individual may have include small skulls, upward slant of the eyes, small nose, small ears, and short or stubby hands. So there's 3 types of Down syndrome an individual may have, and the first scenario accounts for 95% of all cases, and it's a non-disjunctional type, which is when the individual has 3 full copies of chromosome 21. The next scenario accounts for 4% of all cases, and it's the translocational, and it's when the individual has an extra or full partial copy of chromosome 21 that becomes attached to another chromosome instead of separating like it should. And the last scenario accounts for only 1% of all cases, and it occurs when the individual has an extra copy of the 21st chromosome that is only present in some of the body's cells. And you can kind of see in the image off to the side kind of what happens during each of these scenarios. So, individuals who have Down syndrome have memory deficiencies, and the short and long-term memory has been shown to be associated with deficiencies involving the vocabulary development, memory performance, and language acquisition. So, an impaired long-term memory has caused deficiencies for verbal information and visual object association, and these findings have suggested a link to the impaired functionings of the prefrontal brain region, and you can kind of see where the prefrontal cortex is in that image above. So, overall management for Down syndrome. So, a newborn suspected with Downs is to undergo a chromosome test, and then once it is confirmed that they have Down syndrome, the family will then reach out to a clinical geneticist and will undergo further genetic testing and will be in counseling. So the best management of Down syndrome is parent education. So just knowing what your child's going to face in the future will better help you prepare for how you can provide the best future for them. So a balanced diet, regular exercise, and physical therapy are suggested for the optimal growth and weight gain of individuals who have Down syndrome. For future research has been focused on pharmaceutical treatments in order to increase cognition. So you can kind of read there a little bit about the study that has been going on. So overall, Down syndrome is incurable, and current medicine breakthroughs have been focusing on managing the symptoms of Down syndrome. And that's my works cited. Thank you.